Hi, my name is Izabella. Today I'm going to be talking about heart disease. Heart disease is a broad term meaning many different heart conditions. The commonly heard ones are coronary artery disease, or CAD, the most common type, heart attack, congestive heart failure, and congenital heart defects, although these are just a few, there are many more. There are many different causes of heart disease. Congenital heart defects are usually present at birth, but can present itself many years when becoming an adult. Causes during pregnancy include genetics, illegal or prescription drugs, viral infections in the first trimester, increased blood sugar levels, or diabetes. Other types of causes as an adult for heart disease include infections. So, viral can cause inflammation of the heart, myocarditis, by Coxsackie virus, an enterovirus that causes stomach flu. Bacterial isn't as common, but bacteria from the mouth, throat, or gut can travel through the bloodstream and end up in the heart. Tachycardia, where the heart beats faster than normal, is caused by smoking and high blood pressure. Another one is bradycardia, where the heart beats slower than normal, caused by hypothyroidism or problems with the sinoatrial node or electrical impulses. There are many different causes that can damage the heart when not diagnosed early. There are many common ones as well: smoking, non-physical activity, high blood pressure, overweight, and stress. Problems may increase from mild to severe forms of heart disease. There are many treatment options available, from mild to severe forms. Mild cases for heart disease include eating healthier, exercising, and quitting smoking. If the disease progresses, a doctor may prescribe medications such as aspirin to decrease the risk of heart attacks. In severe cases, if there is enough damage that may affect daily living and lifestyle changes aren't helping, surgery or a procedure may be the best option, such as angioplasty, stenting, coronary bypass surgery. There are also many different ways to diagnose heart disease. Some common ways to diagnose are echocardiograms, stress tests, and electrocardiograms. Heart disease can present itself differently in men, women, and children. The way it presents itself in children is breathlessness, feeding difficulties, bluish fingers, toes, and skin. In men, it can present itself as a heart attack, meaning chest pain or discomfort, upper back or neck pain, heartburn, upper body discomfort, and arrhythmia, fluttering feelings in the chest. In women, neck, jaw, shoulder, upper back or abdominal discomfort, pain in one or both arms, sweating, lightheadedness. Commonly for women, symptoms present themselves when resting or when already asleep. Women might not always recognize symptoms, and when they do, damage to the heart has already been done. The commonly shared symptoms for men, women, and children include indigestion, nausea, vomiting, shortness of breath, dizziness, and fatigue. There are many factors that can increase chances for heart disease between men and women for coronary artery disease, a type of heart disease. Age, race, health, and genetic factors all play a role. In men, heart disease is common in African Americans. 1 in 14 have CAD. Hispanics, 1 in 17 have CAD. Caucasians, 1 in 13 have CAD. For American Indians and Asians, for men, there wasn't not enough info. In women, heart disease is common in African Americans, Caucasian, and Hispanic. 1 in 16 women have CAD. Asian women, 1 in 30 have CAD. American Indian and Alaska Native have the same prevalence for CAD. In the United States, heart disease is the most common in the Midwest to southern states in middle-aged to older adults, ages 35 and older. Sometimes there are no symptoms in individuals, which increases the risk for death. Heart disease survival rate is determined by stages over a 5-year period for each stage. Stage A has a 97% survival rate with no symptoms or damage, but are at a high risk for developing heart disease. Stage B has a 95% survival rate for having structural heart disease with no symptoms or signs. Stage C has a 74% survival rate for structural heart disease with current signs and symptoms. Stage D has a 20% survival rate for advanced or severe heart disease. Currently, replacing a heart includes a transplant at the most chronic stage, Stage D. Taking care of your heart and reporting any symptoms to your doctor reduces any complications. Thank you for joining me today talking about heart disease.